that, we'll hear from our very own CEO and co-founder, Theodoric, who will share not only the story behind Intellect's growth, but also our bold, ambitious vision for the future. So without further ado, let's welcome Theodoric.
All right, well, good morning, and a warm welcome to everyone. Thank you so much for coming to the 4th edition of Mental Festival, where we actually want to bring together experts, thought leaders, and fundamentally people that actually care about mental health care to speak about the subject, improve literacy, improve access. But a big thank you to our guest of honor, SPS Eric Chua, all of our honored guest speakers, experts that are here today with us. It's always a very nice feeling event to see everyone coming together in person. So I'll have just a short segment, touching a bit about the history of, how we got started. Some will be filming with us already today, but I'll give a bit of a background as to, where we came, why did we start what we're doing at Intellect, the journey we've made so far over the last 4+ years that we've been around, but also the path that we're charting forward as well, right? How we've seen mental health care really grow in awareness, grow in literacy, and grow in need, which is a great thing. But what's more from there? But before I dive into all of that, today's event, it's super exciting. Every year I say this, but this year is our biggest and best mental festival yet. So we have a great lineup of speakers. Some of you guys would have seen the itinerary from experts from, as Cass shared earlier, public, private healthcare, HR leaders, public sector folks, and experts in this field talking about different aspects of mental health and well-being, with the goal, very simply, to improve and increase awareness. And importantly this year, the theme of expanding horizons, to really push boundaries and take action. All right. I think a key thing that I share sometimes with folks that I speak with, it's over the last 4 years of the pandemic, we've seen a lot of headway and stride, being made around literacy of mental health, awareness of mental health. But we cannot assume and mistake the fact that this progress made is the job being done. Right? This is where the job begins, where action taking actually needs to begin. So do not confuse that awareness done, it's job done. It's where actually the real work begins. So with that, I'll dive right into the segment. So our origins, very, very high level. Intellect was started at the tail end of 2019. So it's about, over 4 years, coming to 5 years now. And it's been a very busy few years for us, to say the least, and a very exciting one and a fulfilling one as well. I'll give you just a very quick run through Intellect. I co-founded the company Intellect through personal lived experience. For the better or for worse, I'm not a clinically trained person. I'm not someone that actually been through such training, but I'm someone that actually have gone through therapy since a pretty young age. I struggled with anxiety and quite chronic anxiety growing up, and started experiencing panic attacks when I was actually 16 during secondary school, right? And that's where I started my journey to see a psychologist. I count myself quite lucky because my parents, while they did not fully understand mental health and all of that back then, they were open enough, I would say, to allow me to actually seek support. We're not opposed to it. I know some families and friends that parents were a bit more opposed to it. So my journey began there, and the very simple, clear message that I took away from my first therapy session was how cathartic, how amazing it is, and how misunderstood therapy and counseling actually is. If people actually knew what therapy was, everyone would be seeing somebody, right? So my journey started from going from coping with my issues towards actually bettering and thriving as an individual as well. So that's my own personal journey, and fast forward many years there, all of us would have this, first-hand accounts, second-hand accounts, ourselves even going through different mental health struggles. But very clearly, not long ago, the topic was still very taboo, very stigmatized, and access to care was not very readily available, right? The most common ways we see is public sector care, and that's something we often see as more acute, more downstream critical illness type. So we set out to change this approach to care. We started to build a mental health care system that is relevant and accessible to everybody. And when we talk about access, it means a couple of things to us. Number one, accessibly in terms of your fingertips, right? It's an app, it's a web. We now have our clinics, and hear about this a bit more later. But it's also accessibly in terms of relevance to our day-to-day lives. Beyond just the clinical issues of depression and anxiety, which are really important, we want to also address the everyday needs that you and I can relate to. Things before it reaches a breaking point, waking up feeling lousy, struggling with your colleagues, your spouses, your bosses, whoever it is, right? Things that can help us take the first step. Because as we know quite well today, mental health is on a spectrum. It's not a binary black or white thing. We're not ill or not ill. We do have fluctuating needs at different points in our life. So that's what got us started. Happy to share 4 years plus in Intellect, objectively the region's leading mental health care service provider, and we have big global ambitions going beyond, and that's kind of the slight theme we're alluding to with expanding horizons. Today, Intellect serves over 3.7 million lives, many of the world's largest employers, insurers, partners, and community partners as well, and growing. All right, so I believe one of the next things I have is actually a short video that before I go into the other aspects that just touches upon what Intellect actually does. So we'll give a minute for. Great. So that gives a bit of the background as to the origin of Intellect. What I want to touch on next is the journey we've made so far, and what we've done and what we are aiming to achieve. The simple mission for Intellect, it's a simple but ambitious one. We want to rebuild a mental health care system that, as I shared, can create access and relevance for everybody out there. So our journey began, when we launched our first beta product in 2020. It was actually self-guided, scalable care, right, of CBT programs. That has since come a long way, we started serving different employers and individuals, but today I'm very happy to share that our vision has expanded, very tight to our core goal of serving different payers out there. Not only do we work with employers, we work with major insurers, public and private healthcare partners and sectors, and individuals as well. All right, so I'll touch a bit on this. So most will be familiar with this. Intellect, while we're headquartered here, we have a very global footprint today. All right, our vision when we began our journey was to provide APAC-wide care. We've since transcended that quite a fair bit. Intellect is now available in 30+ languages. We have clinicians on the ground in more than 60 countries, and this number is rapidly growing every month as well. What we see very clearly is that there needs to be parity of care across the board. And we now do this from very preventative support, as you have seen, self-guided care, screening, all the way to coaching, clinical teleconsults, crisis care, and even more chronic specialty care, as you see in a second. All right? And when we think about how we want to do what we do and look at what we're working at as well, I think it's important to not forget the fact that day in, day out, we're working to build this platform, to build this ecosystem. But the reality that I remind myself and our team is that we actually have a very real impact on people's lives, right? People do need help in different ways, from small to big needs, and the core part of our work is actually ensuring that we give them relevant support in these types of needs every step of the way, as whatever they come to. And of course, the employers, happy to have a lot of our clients and partners here today. We serve many of the world's largest employers for many years now. And what's exciting to me, it's not only what we do here, but the work that employees themselves are doing, the priority they're giving towards mental health care. We've seen this journey, evolve rapidly over the years. It started off as a more nice to have, 5, 6 years, 10 years back. But over the pandemic, and very much so today, we've seen this become a priority for a lot of our clients and many more that we're working with as well. And you can see this in the feedback that we have our clients, sharing with us how Intellect goes beyond actually just supporting the employees, but importantly, the HR teams to drive and design, well-being strategies that actually work to engage people as well. And this is one of the big exciting things we launched this year, Intellect's own chain of clinics. We've had partner clinics across the world for a number of years now, but we realize, and quite naturally, in the next fourth of development, extending our care is going beyond virtual into in-person high-touch care. So happy to share, this year we launched our own chain of clinics. We've now got 4 clinics today, and in just less than a year, we've seen thousands of clients and patients in our clinics, and we have bigger plans. We now have clinics covering different parts of the island, from the south to the east to a bit nearer to the middle of the island. We'll have more coming in the west and up north as well. But the goal is that we want to cover more and more care, more and more needs for everyone. And this strongly ties into the goal of creating accessibility. We know quite well that while app and tech may be scalable, it may be easy to reach, but it may not be something that fits everybody out there. All right, so in-person care is something we're pushing heavily into, not only in Singapore, but across the region as well. All right, and this is a big one that also happened at the end of last year, thereabouts. Intellect became, and I'm sure most will be familiar with this, mental first aid. Intellect became the official and exclusive training provider of mental first aid certification in Singapore. So this actually equips and trains people to be mental first aiders, and happy to share in less than a year, we've trained over 1,000 mental first aiders across various corporates, the public, and more, increasing access towards mental health first aiding, and actually really pushing that support to more than just the key stakeholders in the organization, more than just HR, more than just the management team, but also anyone that really wants to help and support as well. All right, and of course, not forgetting our partners importantly. So a key part of Intellect's agenda to grow and move as well, and our channel to grow rather, is actually working not just by pushing it ourselves, but along with partners across various fronts. We work with private sector partners, we work with the government like MHF, we work with public SSAs and the like there, with the goal of increasing access beyond those who can afford it, but also those that actually need it fundamentally as well. So happy to call a couple of these things here, our partners that have been working with us over the years. We could not do this without you guys. And an important part, shout out to our clinical team and Dr. Oliver who's here with us. One of the biggest things that sets Intellect apart is our core focus on being the most evidence-based, the most clinically backed mental health care company. Not only are we doing things that are, rah-rah and self-help, but all that we do, it's very much so grounded in science and research. So happy to share now, we've got tons of, 10 plus papers that are published or to be published soon. And to the extent that, one of our studies got actually mentioned earlier in Parliament this year as part of the discussion around mental health being an increasing topic for the nation as well. So shout out to our clinical team for the good work they do here. Okay, so the last segment before I wrap up the opening, mental health care as a space has made great strides across the world, across Asia, across Singapore. It's come some way. What's going to happen next? All right. So I think what's happened before I go into the next slide, it's awareness has been made. All right. It's not fully done, to be clear, but we've definitely made big strides here. And what I was actually sharing with SPS earlier, and what's very exciting is actually, after years of hard work from all stakeholders in the ecosystem, not just ourselves, the key heavyweight players and stakeholders are now ready to move as well. We see the government, actually moving heavily. Last year, the government announced the National Mental Strategy. It's a great sign of the push, and I think in Singapore, in many ways, it's really leading the charge on this in our region here. We saw, we see insurers now, really pushing and wanting to cover mental health care. And we see also individuals, compared to the behaviors from the start when we began our journey, and now a lot more willing to seek help, for help-seeking behavior. So I think a lot of progress has been made, and our work has evolved from providing scalable care to now deeper care. So what will happen next? I'll just touch very briefly on what we're excited about next. All right, and this is a key step, I think, just to highlight here. The one on the left, it's actually a very new stat. Some of you guys who have seen this, it just came out, I think, on Straits Times last Friday, where 1 in 3 youth actually reported very poor mental health. So the youth and the education sector is one that we heavily see a big need, and this is not news to any of us. And we have the privilege of serving, multiple institutions today, from NUS, NTU, and many other schools today in supporting the students. But there's a lot more to be done here. All right. Second thing, it's even not just slide back, not just the young, but even those that we think beyond folks that the age range that are interested in mental health care, those that are senior, more older, actually also have real issues to address. 1 in 7 actually have a mental health disorder that they need to address or goes unaddressed from there. All right, so what I'm trying to point out here is that beyond just general mental health needs of the adult population, those with adolescents, those with youth, those with the geriatric population is very real, and it's not something to be ignored. All right, we'll come to that point. This is actually a key point. So that's why actually a big part of what really exciting to me, amongst other things I wanted to call out, it's Intellect's going beyond general care. We now are really, pushing big into specialty care as well, right? Beyond this general mental health needs, we see more and more demand and need for more specialized needs and more acute populations needing support. So that's a big one you can expect us to go heavily into. We now support youth, we now support different, more acute, trauma-related care as well. You'll see more of us doing this later as well. All right? And one of the last things here, it's, in line with our theme of expanding horizons, a big part of Intellect's ambitious goal is to increase access more and more so. With the nature of clients and partners we serve, Intellect's going beyond APAC. We now have expanded our care beyond APAC already, and we're actually going into more countries in Europe, in the West, to really increase and provide parity of care no matter where anyone is. So we have big plans. We have a busy road ahead of us, and I've been, firstly, very thankful for all of the support of everyone here with us on our journey so far. This festival and event is not just about Intellect, it's really about all of the work we're doing in mental health care to really increase awareness, literacy, and importantly, action taking.